Hello again. Today we are going to answer the question, why does the nucleus pulposus herniate more posteriorly toward the intervertebral foramen and the spinal canal than anteriorly? We can explain this phenomenon with three reasons. The first reason is related to the annulus fibrosus, which is the tough structure that surrounds the nucleus pulposus. This structure is weaker and thinner at the posterior and posterolateral regions of the disc, making them more vulnerable to rupture. The second reason is related to the longitudinal ligaments, which are the bands of tissue that run along the anterior and posterior surfaces of the intervertebral discs and the vertebral bodies. The anterior longitudinal ligament is wider and stronger than the posterior one, covering and supporting a larger area of the disc and resisting tearing of the annulus fibrosus. The posterior longitudinal ligament, on the other hand, is narrower and weaker, especially at the posterolateral direction, and less capable of resisting tearing of the annulus fibrosus. The third reason is related to the biomechanics of the spine. The nucleus pulposus is subjected to a compressive force that is directed more posteriorly when the spine is flexed or bent forward, which is a common posture in daily activities. This force pushes the nucleus pulposus toward the posterior and posterolateral regions of the disc, where the annulus fibrosus and the posterior longitudinal ligament are less able to withstand the pressure. These factors make the posterior and posterolateral regions of the disc more prone to rupture and herniation when subjected to compressive force, resulting in compression of the adjacent nerve roots inside the spinal canal and at the intervertebral foramen. Thank you for listening.